Hi, I'm Dimitrios Colevas. I'm a medical oncologist from Stanford, and I'm here to talk to you about a study in patients with Epstein-Barr virus positive nasopharynx cancer. This trial will be in the recurrent metastatic setting. It is designed for patients for whom the standard of therapy now is gemcitabine plus platinum plus immunotherapy. As many of you know, this is suboptimal. Many of our patients still relapse and die. In this setting, most patients respond to gemcitabine and cisplatin plus immunotherapy, but a number of them eventually relapse. The question being asked here is, in addition to immunotherapy, nivolumab in this case, will the addition of a LAG-3 inhibitor in the adjuvant setting decrease those numbers of relapses? That's the trial we're looking for. It's a randomized trial of gemcitabine, platinum, nivo, and in the adjuvant part, plus minus the LAG-3 inhibitor, Relatilimab. I think it's important to acknowledge this is a very specific patient population, mostly people of Asian descent, specifically from the hotbed of southern China. I practice in a Pacific Rim city of the San Francisco Bay Area. This study is not for patients with EBV negative nasopharynx cancer. I think the second most common question is, to antibodies, to immunotherapies, what are the side effect profile going to be like? I think A, we don't know, that's why it's on a trial. B, I think based on data from melanoma, we expect this to be tolerated really to the same extent that gemcitabine platinum immunotherapy with the single agent is tolerated. So I think the next step is going to be, and which we're also pursuing in parallel, is what about immunotherapy earlier on in the treatment of this disease? I think there's been mixed data on whether or not adding immunotherapy to fundamental chemoradiation backbone makes sense in a number of diseases. I think in this one there's some very promising data that suggests at least before and after radiation in patients who are curable that may be beneficial. Will it be things targeting PD-1 alone, or will the addition of LAG-3 make a difference? Maybe. I think that's going to be the next step. Like in so many things, we test it in the recurrent metastatic setting, and if promising, we move it to curative patients. Yeah, it should be really easy. This is a study that's not that different from what is being done normally. And I do want to highlight this is so-called adjuvant treatment. That is, everyone gets standard immunotherapy with nivolumab, plus gemcitabine, plus platinum, and only after that will they be randomized to the addition of Relatilimab, the LAG-3 inhibitor.